away.
So Jamie has been complaining about left shoulder pain. So we're going to do some electroacupuncture to try and relieve the pain that she's feeling in the upper trapezius and the rhomboids. So the upper trapezius has 10 agonists and 5 antagonists. So an agonist is a muscle that contracts with the muscle. So the upper trapezius and the rhomboids are agonists. They contract together. So maybe we will target those muscles with the E-stem and needle those muscles. For the sake of the video, we'll probably just work on the back today. So I'm feeling the upper trapezius and it's very ropey. And if I go a little deep into the erector spinae, that is also very ropey. And that could be a culprit too, because the innervation for the shoulder is T7, T6, T5, and also C7 spinal accessory nerve. So I might needle T7, T6, and T5. And I also feel an adhesion in the subscapularis muscle and in the supraspinatus. Supraspinatus, infraspinatus. So supraspinatus is the agonist and infraspinatus is an antagonist, which is kind of funny. You wouldn't think that. I hope I'm correct about that. If I'm not, use Dr. Google and take a look. So we're going to get started. So I'm using Tucson 34 gauge needles. What I'm going to do is I'm going to grab the upper trapezius and I'm going to form a C shape with my fingers so I can needle into the belly of the muscle. So I'm actually at around Sanjiao 15, and I'm going to needle right into the belly of the muscle, and I'm going to do a little sparrow pecking in there until I can get a little contraction of the muscle, which you felt. And then I'm going to twist the needle into the muscle fibers. So that's your upper trapezius. I'm also going to take a look at this trigger point here in the subscap. The lat seems to be okay, really just this subscap here, right here. So same thing with this. In this area, I'm gonna pinch where the adhesion is. And I'm gonna needle into the area that I'm pinching. Now, because this is close to the lungs, I'm going to take the needle out once I feel a contraction. I'm not going to unpinch the skin because that's going to draw the needle closer to the rib cage. Are you okay?
Mm-hmm.
And I don't want the needle to go into the lungs. So it's probably a little hard to see this, but I'm doing some sparrow pecking here. In Western medicine, we call that dry needling. And I'm breaking up this adhesion in the subscap. All right, so it's a little better. I'm just going to take that needle out for safety purposes. And I'm going to place another needle into the motor point between the posterior deltoid, the long head of the tricep, and the lat dorsi. The lat dorsi is also an agonist muscle of the upper trap, and the motor point is small intestine 9. So I'm going to needle into that. In TCM, that is where the chi for the shoulders, the most chi is in small intestine 9. So I like to use that point. I also sometimes add small intestine 10. And that might be good for that posterior deltoid. It's a little ropey back here too. Really the tricep too. I might do a little dry needling in the tricep. Apparently Jamie needs a lot. But let's do a little pinch at small intestine 10. I'm going to do a little sparrow pecking right here as well. And that's also very ropey. And we're going to do a little twist of the needle to get the needle into the muscle fibers. The purpose of the twist is when I hook up the E-stem, I don't want the needle coming out. I want the needle attached to the muscle so we can get a good contraction of the muscle. So I'm also going to needle small intestine 11. I'm going to needle T7, T6, and T5, but I'm going to needle the jaw G points, so we're not going to needle the spine. We're going to needle just lateral to the spine, a half a sun lateral. So 17, 16, and 15. So even though we're doing what I call Western acupuncture, I'm still doing Japanese insertion because that's what my brain wants to do. We'll also needle bladder 17 with the flow. And we'll needle that bilateral. And then I'm going to do the same thing on the right side as well. So let's see, maybe the right upper trap is worse. Sometimes that happens. So we're going to lift the trap up off of the scapula. And I'm going to needle into the belly of the muscle around Sanjiao 15. And we got a contraction that went all the way over to the other side. Probably felt pretty relieving. Yeah. Same thing over here with this, we're in the like posterior deltoid teres area. So I don't know if you could see this in the video, but what I'm doing is I'm pushing the muscle to create a ridge, and then I'm needling into that ridge. And I'm going to do some sparrow pecking until I get a little contraction or until I feel like that's enough. Okay. Small intestine 9. And small intestine 11. Okay. So whenever I'm treating pain, I always needle bladder 18 because bladder 18 is the back shoe point for the liver, and the liver governs the nervous tissue and the tendons. And the health of the tendons is what determines the tension in the muscle. If the tendons are tight, it's going to put more tension on the muscle. Okay. One other thing I'm going to do is I'm going to dry needle erector spinae. So I'm going to just move your dreads. And I do this the same way. I hope you could see this, but I take my fingers and I pinch the erector spinae so it's raised up off the neck, and then I'm going to needle into the erector spinae muscle, and I'm going to do some sparrow pecking here. One of my favorite things is when I get an instant release there, but it doesn't always happen. You doing all right, my dear?
Mm-hmm.
Yeah. Same thing on this side. Pinch, needling into it, and sparrow pecking. So I'm in a bit of a lunge here because of my position, and also so you can see me. And normally I would choose a little bit of a better posture to stand in when I'm doing this. But for the sake of this video, posture does not exist. All right, so now we're going to hook up the E stem. So we're going to use 2HZ. 2HZ is for tissue repair. It also helps to relax the patient, and it helps with insomnia. And it's going to give me a big contraction of the muscle. But we're not going to go too crazy. You know, we want to do E stem within the comfort of the patient. So I'm going to turn it up very low and see what's comfortable for Jamie.